Megan.
And I'm Clarity.
Today we are going to be demonstrating safe core exercises for individuals with osteoporosis.
This will help with improving endurance for abdominal muscles used for postural stability.
A few things to keep in mind to ensure these exercises are performed in the safest manner for those with osteoporosis. Choose a comfortable position.
When activating deep abdominal muscles, do this gently, not with force. Activate by correct posture. Maintain an inward curve in lower back while in prone position. Identify abdominal muscles. This can be done by gently drawing your belly button inwards as if someone's poking you in your stomach. Maintain regular breathing while muscles are engaged. Relax abdomen and rest briefly to recover.
Make sure you are comfortable and pain-free during and after the exercise. If pain persists, stop the exercise and rest. Resume in 2 days once pain subsides. This also may require modification to the exercise.
Gradually progress to higher levels of exercise.
Let's begin. Since this exercise is done on the floor, we will start with some safety tips on how to get down to the floor safely. First, have a balanced object close by, like a chair or table. Place both hands on the chair. Lower yourself down onto one knee, then bring the other knee down. Put your left hand on the floor. While leaning on your left hand, slowly bring your left hip to the floor. Put your right hand on the floor next to the left to steady yourself. You should now be sitting with your weight to your left hip. Straighten your legs. Bend left elbow until weight is resting on it. Use right hand for support if needed. You should now be laying on your left side. Stretch out your arm so that you are laying flat. Log roll onto your stomach. We call this the prone position.
There are 2 ways this exercise can be done for beginners: in the prone position and on your hands and knees. We do the prone position for those who are uncomfortable doing it on their hands and knees, also called the table position. In the prone position, we'll place a soft support object, like a pillow, under your pelvis to take some of the pressure off the spine, and we will only work our legs. The other way to do this is on our hands and knees, or the table position. Hands should be under your shoulders, elbows slightly bent, knees below the hips. It is important to have your lower back slightly curved. This will allow the muscles to work most effectively. Both will keep their chin tucked to minimize pressure on the neck. First, we will start by activating the tummy muscles. Try to gently draw your belly button inwards as if someone is poking you in the stomach. This will activate the core muscles. Remember to ensure you are drawing in gentle breaths for these exercises. Try and hold the muscles in while breathing. Hold for a count of 10 and then relax. Next, make sure your hands are still below your shoulders and knees below your hips with an inward curve of the spine for those in the table position. Tummy muscles must remain active. For both positions, let's start with a leg raise. Reach one leg, bringing it up and taking the leg backward, no higher than your buttocks, and then down. Keep your tummy active and reach again. Then the arm raise. Reach one arm, bringing it up and taking the arm forward, no higher than your shoulder, and then down. Keep your tummy active and reach again. Repeat this exercise 8 to 12 times. 1 rep is equal to raising the arm and leg once.
Once you have mastered the beginner's exercise without any pain, you can advance to the intermediate exercise. This will be done on your hands and knees. Gently engage or draw in your lower abdominal muscles. Reach forward with your left arm and raise your right leg simultaneously. Keep your lower abdominal muscles activated throughout this exercise. Raise the extended arm no higher than your shoulder and leg no higher than your buttocks. Slowly lower your extended arm and leg to gently touch the ground. Repeat this lowering and lifting action 8 to 12 times consecutively. Breathe normally throughout. Release and rest briefly before repeating this exercise using the opposite arm and leg for approximately 8 to 12 repetitions.
When you have mastered the intermediate exercise without pain, challenge yourself with the advanced level. We do this by moving our arms and legs to the side. Reach forward with your left arm and raise your right leg simultaneously, then move them slightly to the side. We can also do this with our legs only and arms only to make it a bit easier to start. Keep your lower abdominal muscles activated throughout this exercise. Breathe normally for the count to 10. Release and return to starting position. Repeat this exercise 8 to 12 times. If at any time you experience pain in any of the 3 levels, please stop immediately. Try again after 2 days once pain has subsided and start at an easier level. Thanks for joining us!